Assisting someone else with their dental care. I'm fond of saying that flossing doesn't necessarily need to be fancy, and in fact it can be really fast. Just getting the floss in there, going in between the teeth. You want to do as good a job as you possibly can, but just the act of getting in there with the floss means that you're doing a whole lot more in terms of oral health care than a lot of people do every day to take care of themselves or to take care of somebody else. The same thing goes with brushing. Brushing the teeth twice a day or after each meal, if at all possible, will do more to maintain good oral hygiene and then in turn good oral health. It's a relatively simple concept, but it can go a long way in terms of maintaining excellent overall oral health during the course of someone's lifetime. How to brush someone else's teeth, particularly in situations if the person whose teeth you're brushing may have issues with them brushing their teeth and have disruptive or otherwise difficult behaviors. In general, brushing someone's teeth is best from the side or slightly behind the person. This is in contrast to flossing, which is best done actually directly facing the person. The first thing to do is to gently come beside the person. At this point, I always gently rest my hand on their shoulder and explain to the person what we're about to do. Melissa, what we're going to do today is we're going to start to brush your teeth, okay? If the person is slightly apprehensive, I find that this initial contact often establishes a reference point to know that something is about to happen. Visually impaired patients in particular, I found, have benefit from this. We then go ahead and retract the cheek with the finger of a hand. This is all going to be done at home, taking care to keep the finger out from in between the teeth. Always stay to the side. This is to prevent a bite if the person were to inadvertently close their mouth while you're working. We then go ahead and brush the teeth using the same small circular and sweep motion that we spoke about previously, and working our way from the bottom to the top and all the way around the mouth. Working on this side, we retract or pull the teeth back with the finger of the right hand, the same hand that's holding the toothbrush. We can then, using the small circle and sweep motion, clean the teeth on the top and bottom sides of the mouth, taking care to keep our finger once again out from in between the teeth, so that if the person closes their mouth, they won't close it upon our finger. Following completion of this, we can brush the tongue and then exit the mouth with the toothbrush and complete the procedure.